Pigmentation problems are very common and they are very multifactorial. The most common ones would include sun damage, hormonal changes, and then we call it melasma, but also post-inflammatory hyperpigmentation, where the skin gets darker because of acne or any other insult to the skin. There are lots of different things we can do in clinics, and we'll run through a few of them of my favourites. To start with, when you come into clinic, you are going to be put under the skin analyzer. That is a fabulous high-tech camera that uses for pigmentation ultraviolet light, which shows the pigmentation changes on your skin in a deeper level that we can't see with our naked eye. I brought it into clinic because I think it's a really nice way of being able to confirm that any treatment is working, because we all get some skin analyzer photographs over the months of your treatment time with us. Treatment always starts at home and with good, decent skincare. If we're looking into pigmentation problems, there are two main things that I would be recommending usually for your skin care at home. It would be a vitamin A, a retinol or a tretinoin. That doesn't necessarily stop the pigmentation, but what that does is it increases skin cell turnover. By making the skin more active, it can really help clear that pigmentation. But while we're clearing it with a retinol, we also need something to stop it happening in the first place. They're usually called tyrosine inhibitors because it's the tyrosine pathway that creates the pigment. Strong and powerful tyrosine inhibitors would be something called hydroquinone. That's the prescription level ingredient, but also an arbutin. Vitamin C is lovely. It's a weak tyrosine inhibitor, but it's a bit of a cover-all serum that we like. And there's lots of different peptide technologies coming into skincare as well that really help target pigmentation changes. For things we do in clinic, we've got an awful lot of options. Let's start with chemical peels. They are a nice treatment. They don't take very long, but superficial to medium depth peels are really good at increasing skin cell turnover, of clearing that pigmentation and creating the healing cascade to lift that pigmentation changes. Also good for anti-aging and any textural changes. If your pigmentation is because of acne, it's good at clearing the acne, clearing the sebum, settling the acne and helping that inflammation that's causing the pigmentation. We've got light devices that are also very effective for pigmentation, and in clinic we can offer you an IPL treatment, which is a broad spectrum light that when it's shined at the skin, the melanocytes, the melanin in the skin, absorbs that light energy, heats, and the heat is what helps clear that. It's a very effective treatment for hyperpigmentation. I'm really excited to have just brought it into clinic for you. Along with light treatments, we've got LED. That is something that we can add into any other treatment you've got, but especially mid-visible light spectrum, so the green light or the near-infrared light is really calming, anti-inflammatory, can really help lift that pigmentation in the background, and it's a good addition to anything else that we would do in clinic for you. Microneedling is also another lovely option. Specifically for pigmentation, depends what we add to it. So microneedling is where we are creating micro traumas to the skin. And by creating micro traumas, the skin heals itself and heals itself better. It's incredibly good at boosting collagen and elastin and anti-aging. But if we add in goodies to help the pigmentation, we can make it really effective at lifting pigmentation as well. In clinic, one of my favourite ones is the Pluriel Mesoline Therapy Kit, where they've got lots of ingredients, but including tranexamic acid and glutathione that we can microneedle into the skin, which is very much scientifically proven to help lift pigmentation over a period of a few treatments. One of my favourite things to microneedle in at the moment is exosomes. That is the latest in regenerative medicine. They are nanoparticles, and we are only just learning how skin cells communicate with each other. But that's been shown to be incredibly anti-inflammatory. It's wonderfully anti-aging. It gives your skin a real glow, but really helps target those pigmentation and lift it in a way we don't fully understand yet. But it has been really effective in clinic over the months that I have been offering it as a treatment. The other option, if you have a specific area of pigmentation, usually sun damage related pigmentation, is the cryopen. So the cryopen is a small device that uses liquid nitrogen to freeze the area of tissue, and by freezing it, it creates damage, the skin heals itself better, and it heals itself by lifting that pigmentation area off. So if you've got areas of sun damage and specific areas that we can target, the cryopen might be the option for you. There are a lot of different options we have in clinic. It's always best to come for consultation. Some of it is personal preference, some of it might be better for you than others, and also some of it is just what you fancy. Come and have a chat to us and we can always answer any questions.